Hey everyone, and welcome. Today we're going to dive into a medication called Solifenacin, which you might know by its brand name, Vesicare. It's designed to tackle a really common and, let's be honest, pretty frustrating problem, an overactive bladder. So we're going to break down exactly how this little pill brings some much-needed calm. So here's our game plan. First, we'll get a handle on what an overactive bladder even is. Then we'll get into the really cool science of how this medication actually works to calm things down. After that, we'll cover all the practical stuff. How to use it right, what side effects you might expect, and some super important safety points you'll want to keep in mind. All right, let's kick things off with Section 1, the overactive bladder problem. It's all about understanding what's really going on. So what really makes a bladder overactive? It sounds simple, right? But the answer really gets to the heart of the issue and what so many people deal with every day. Let's dig in. It basically boils down to these three main things. First up is urgency. That sudden, out-of-nowhere feeling that you have to go, and I mean right now. Then there's frequency, which is just what it sounds like, needing to go a lot, usually more than 8 times in a day. And finally, urge incontinence. That's when that sudden urge actually leads to an accidental leak. These are the exact symptoms that Solifenacin is designed to help with. Okay, now for the really fascinating part. How does this medication actually work? To make it super easy to understand, we're going to use a simple little analogy I like to call the key in the lock. But first, before we get to the medicine, let's do a quick refresher on how your bladder is supposed to work. It's actually a pretty straightforward 3-step chain reaction. Your brain sends a signal down to your bladder. That signal triggers the release of a chemical messenger called acetylcholine. And then, that messenger tells the main muscle of your bladder to contract, or squeeze, pushing urine out. Simple as that. Okay, so here's our analogy in action. Imagine the surface of your bladder muscle is covered in tiny little locks. The chemical messenger, acetylcholine, is the real key. When it clicks into the lock, it turns and tells the muscle to contract. Now, enter Solifenacin. It acts like a blocker key. It's shaped just right to slide into the lock, but it doesn't turn. It just sits there, physically blocking the real key from ever getting in. And this is the direct result. On the left, without the medication, that real key gets in, causing those unwanted involuntary contractions that create that feeling of urgency. But on the right, with Solifenacin playing goalie and blocking the receptors, the muscle never gets that signal to squeeze. It stays relaxed, which allows the bladder to hold more and gives you fewer of those sudden frantic urges. Pretty clever, right? So the science is cool, it makes a lot of sense, but now let's switch gears to the really practical stuff, how to actually use this medication correctly. The usual starting dose for Solifenacin is 5 milligrams, and that's just once a day. Now, depending on how you're doing, your doctor might decide to bump that up to 10 milligrams to get the best effect. And here are a few simple but really important rules for taking it. It's a once-a-day pill. You want to swallow it whole with a full glass of water. And this is key. Don't crush it or chew it. That could mess with how the medication is released into your system. And for convenience, you can take it with food or on an empty stomach. Doesn't matter. All right, we have to talk about this next topic because it's incredibly important. Side effects. We need to be clear on what's common and what's serious enough that you need to watch out for it. This table lays it all out pretty clearly. Let's look at the left column first. The common effects, things like dry mouth, constipation, maybe some blurred vision, they actually make perfect sense. Remember how Solifenacin blocks those receptors? Well, it blocks similar ones elsewhere in your body, and that's what causes these effects. But now look at the right column. These are the serious ones, and they mean you need to seek medical attention right away. Things like a severe allergic reaction, like swelling or hives, not being able to urinate at all, really bad stomach pain, or any sudden confusion or hallucinations. And all of that brings us to our final and absolutely critical section, important safety considerations. Let's talk about who needs to be especially careful with this medication. Okay, this is crucial. Solifenacin is not for everybody. It should absolutely be avoided if you have certain health conditions. For example, uncontrolled narrow-angle glaucoma, because it can increase pressure in your eye. Or if you already have urinary retention, meaning you have trouble emptying your bladder. Same goes for certain severe stomach or intestinal conditions, or if you have severe liver problems. It's also so important to know that it can interact with other medicines. Here are 2 big examples. Certain powerful antifungal drugs can actually cause the levels of Solifenacin in your body to spike, which really increases your risk of side effects. Also, if you take it with other drugs that have a similar blocking effect, some antidepressants do this, you can end up with a double whammy of side effects, making things like dry mouth or constipation way worse. So, all of this brings us to the final big picture question. There's no doubt that sulfenacin can be a really effective treatment. It gets to the root cause of overactive bladder symptoms and can be a huge relief for so many people. But as we've seen, it's not without its risks and considerations. So, is it right for you? Well, that's a question only you and your doctor can answer together, after having a really thorough conversation to weigh all the potential benefits against the potential risks for you personally.